In 1943, Wentworth Hospital was founded as the Royal Navy Auxiliary Hospital, built specifically to accommodate the World War II South African Navy, which was based in Wentworth, KwaZulu-Natal, South Africa, which we now refer to as the South Durban Basin. At the advent of the apartheid era, the National Party, who was the ruling party at the time, then purchased what we now refer to as the Wentworth Hospital. And just a fun fact and something that I found really interesting, the hospital was only purchased for £600 British in 1948. During this time, Wentworth Hospital was classified as a cardiothoracic surgery, neurosurgery, neurology specialist hospital, and later on specialized in plastic and reconstructive surgery for the Navy who came back from war and were injured. Which means that the hospital would have had to have the best doctors and the state-of-the-art facilities in order to attend to the Navy who sustained brain, surgery, limb injuries during World War II and may have required treatment or plastic or reconstructive surgery at the time. In 1994, South Africa was then declared a country of democracy, and in early 2000, the hospital was declared a district hospital. And then the decommissioning of these specialist facilities then took place, which means that the facilities were then moved to other specialist hospitals. Once the hospital was declared a district hospital, rezoning then took place, which allowed people from surrounding communities and within the Wentworth communities to receive medical care from the hospital on a referral basis or in cases of emergency and trauma. However, members from the Wentworth community feel that the standard of the medical facilities, the standard of the management of the hospital, and the standard of the medical care received from the medical practitioners has deteriorated drastically over the years. The residents of the community have expressed their lack of trust in what was a highly esteemed hospital to what is now a place that they dread receiving medical care from. There have been numerous cases of malpractice, maltreatment, and negligence which have been reported at the Wentworth Hospital. Mr. Leonard Joseph is a community member and a key role player in the Wentworth community. He has written numerous letters to arrange meetings with the hospital management so as to address the plight of the community with regards to the hospital. But he has failed to secure meetings with regards to these issues with the hospital management. He has also had personal experiences of malpractice and negligence at the hospital. In 2015, the 66-year-old had a heart attack where he was rushed immediately into the care of Wentworth Hospital. According to Mr. Joseph, his hospital file or his patient file clearly stated that he is allergic to penicillin, but it was still given to him by the Wentworth Hospital nurses. He described his allergic reaction to the penicillin as a near-death experience.
I live in Wentworth and I'm obligated to use Wentworth Hospital. And Wentworth Hospital to us is more or less a concentration camp. Reason being, when you go in there, you sometimes are worse off than when you come out. You know, when you come out, you're worse off than when you went in. I'll just give you a bit of detail. I went in with a heart attack, of which I've had 7. And I was in intensive care unit, and that morning I was being discharged. So a nurse took the railings of one bed and left it adjacent to my bed. And I said to her that this is going to be a problem, because if these things slide, it could injure some of the patients, because patients walk in and out of the intensive care ward, not realizing that a few minutes down the line it would happen to me. So as I walked around my bed to go out, because I was discharged, these railings came down and I slipped on them and tore my ligaments. So I tried to get the matter addressed through the hospital with the CEO, that was Carol Dlamini, and unfortunately, she refused to help me in any way.
A few months later, he was then admitted into the hospital again, where he was repeatedly and negligently given penicillin. In December last year, a 24-year-old girl who was pregnant later discovered by her medical doctor that her fetus had no heartbeat. She was then referred by her doctor to the Wentworth Hospital for a surgical abortion procedure. After the procedure had been completed, she was under the impression that the fetus had been removed. A few months later, in February this year, she unexpectedly went into labor when she discovered that the fetus had not been removed by Wentworth Hospital. What's important to highlight here is the severity of a rotting fetus in a mother's womb, as it is a great cause for concern and could cause septicemia in a woman's body.
I went to a doctor on the 19th of December, which happened to be Merebank. After seeing my doctor here and not knowing that my fetus had no heartbeat, I was referred to our Wentworth Hospital. I went to the hospital then, done some a scan. After a scan, they ran some test. After test, they then notified me that there isn't much they can do but for me to come into ANC clinic on Monday. On the 7th of January, I was told to come back in. I go back in and they told me that they'll take me for MBA. Prepared me for the MBA, they gave me my drugs. I went into a little small theatre room. After going into my small theatre room, they told me that the whole procedure has been successful. I didn't go home, but I stopped feeling like severe pains, but thinking it's like the whole procedure of everything, and like pains were normal. But I said to myself, you know, pains, I shouldn't be having such bad pains. Let me maybe go to a doctor. Saturday I go in, I do an ultrasound. Still to find out that the fetus was still in me. It's now been more than a month. I then waited at about 2 o'clock on the 7th of February. The doctor came in and he had no other suggestion but to help me remove this fetus. He then now removed the fetus with his hands. After the fetus was being removed, I then had a one-on-one time with the baby. Then being taken into a small little theatre room to remove my placenta. Placenta was then stuck. It was an awful thing. I had to get a referral letter to King Edward. King Edward was where my placenta was removed, and I went into theatre about 8:15. I came out at 10:20, and after that it's all been good, but I still got some bad side effects. I've got cysts, I've got fibroids, I still suffer with heavy bleeding. There's still so much damages and it's still on continuous pain.
In January this year, a video went viral of a 67-year-old woman who allegedly suffered from asthma and was left in the care of Wentworth Hospital. The video illustrates her crying out for help from the Wentworth Hospital nurses who were on duty due to her being unable to breathe. However, none of the hospital staff assisted her, and it was reported that she later died of cardiac arrest.
Please, can you get this woman my husband? Help here, please. I can't get out of here. I'm watching people try to rock me. I'm going to die like this.
This is what I'm taking for social media, for newspaper.
Sorry?
I'm not interested in anymore.
Look here.
Please.
This tube here, please give it to me. Sir?
The hospital has reported to the public by stating that the nurses were unable to assist due to the hospital being short-staffed during the COVID-19 global pandemic. Prior to the COVID-19 global pandemic, the South African Department of Health placed a moratorium on the appointment of nursing staff in hospitals. Despite there being a shortage of nursing staff, the South African Department of Health failed to lift the moratorium on the appointment of nurses, which exacerbated the problem and led to the crisis of shortage of staff within the hospital. According to an article released by Sun Southlands, on the 20th of March, a 71-year-old man was rushed to Wentworth Hospital for severe dehydration. X-rays taken showed that the man had suffered from a lung infection and a cracked vertebra and was unable to eat for 2 weeks. He was given only painkillers by the hospital staff and told to return back a week later. He then returned to the hospital and later died in the care of Wentworth Hospital. The family is currently awaiting an autopsy result to determine the cause of his death and intends to open a civil case against the hospital for the neglect and mistreatment that they felt by the Wentworth Hospital in managing this matter. So the question is, how do we resolve this crisis? As the intention of this video is a cry out to the South African government and to the South African health officials to work together to improve the state of the Wentworth Hospital, and more specifically to improve the state of all government-managed hospitals that are currently experiencing poor management. Perhaps the following suggestions would assist. Firstly, a full independent investigation should be conducted into the affairs of the hospital, as well as the conduct of the staff, particularly the nurses at the hospitals. Secondly, the community structures should be included into a transparent forum to investigate and resolve all allegations of misconduct on behalf of the hospital and its staff. Thirdly, an audit of core skills and competencies required by the hospital must be conducted in order to ensure that the hospital is supported by a competent managerial team. And lastly, and I think most importantly, and I say this not with the intention to generalize, but a majority of medical workers, particularly the nursing staff, need to take their Hippocratic oath seriously to save lives and to treat patients to the best of their ability, and to understand their vocation as being a healthcare worker. African Diaspora News Channel, Marilyn Couch, South Africa.